syndrome and just having difficulty getting pregnant. Okay. So I was looking over your records. Are you still on the Zera?
Yes.
Okay. How long have you been on that for?
About a year now.
Okay. And that's to regulate your periods, correct?
Right.
Okay. Now, did you have a period of time over which you were off the birth control trying to get pregnant?
Yes, a couple months ago I
Okay.
stopped taking it. The doctor told me just to stop taking it since I'm just trying.
Absolutely.
So that's how long I've been
Okay.
off.
About how long were you off of it for?
About 2 months.
Okay. 2 months. And then when did you go back on it?
I haven't started back on
you're,
it
you're still off. Okay. So currently not taking.
because I just had a menstrual earlier this month.
Okay. So you've been off it for a total of 2 months. So you've only been trying for about 2 months?
Well, I was trying longer than that, but the doctor said stop taking the mess.
Oh, yeah. It's hard to get pregnant on birth control pills. All right. How long had you been on those kind of before to regulate your cycle?
Almost a year.
Okay.
Yeah, and before that I wasn't on anything.
Okay. Were your periods very kind of irregular or spaced apart?
Right, I would come on a couple months, then a month I wouldn't come on, and it was just like that. And then I would come on for 3 months or 4 months at a time. So
Okay.
I know I had something was going on.
Yeah, absolutely. For this, irregular cycles. And so this diagnosis of polycystic ovarian syndrome, how did your doctor come to that? Just by your menstrual cycles, or did she do any blood work? or-
Yes, they did blood work. I believe it was through my urine also.
Okay.
That's how they was able to check.
Okay. 'Cause unfortunately, we didn't get any of those records, so,
Okay.
but she told you that you have PCOS, and that's what we're working with, okay?
Yeah.
Well, kind of, not fortunately, but about 5 to 10% of the population has PCOS, so it's not anything that we're not used to seeing, certainly.
Okay.
All right, and you've never been pregnant?
No.
Do you have any medical problems that you know of? High
No.
blood pressure, diabetes, anything like that?
No.
Okay. And then no surgeries. Looks like you're pretty healthy. You're a home health aide. 2 glasses of wine a year.
Yeah.
Gotta stay honest.
Right.
Otherwise, no issues. Medications, you were on birth control, but you're not now for 2 months, and then some iron pills. What happens when you take amoxicillin?
I'm not sure. I was told when I went to the emergency room at St. Alexis Hospital, they told me that I was allergic to amoxicillin. They didn't tell me
You said, all right.
why.
Maybe as a baby you had a reaction or
I
something
guess
like
so.
that? Okay. All right. And then on the birth control, your cycles are very regular?
Yes.
Not too painful for you, anything
No.
like that? Since you've been off it for the past 2 months, you have had periods, 2 periods?
Yes.
Okay. All right, and you do have some irregular hair growth too, you've noticed kind of on your face and things like that? Okay. All goes along with the PCOS.
Yeah. That's the headache.
Uh-huh. Any diabetes in your family?
Yes, my mother and aunt have diabetes. I was just recently tested for diabetes with my primary doctor, and he said it came back negative.
Good. Who's your primary care doctor, you see?
Dr. Smeltzer, he's over at the Woe Clinic.
Because your blood pressure is a little high today. Have you ever had any issues with that before? It could just be that you're nervous and your hair. We do see that fairly frequently. So. It's getting antsy. All right. And then, what is your name, sir?
Christopher.
Christopher. So Christopher and Christelle.
Yeah.
That's cute. All right. How long have you two been together for?
16 years.
Wow.
Been a while.
Yeah, absolutely. All right. And you're basically healthy, some lymphedema,
Yes.
asthma, okay, and just on a couple different medications. Now, did they do a semen analysis on you?
No,
You
they
never
haven't.
had one done?
Nope.
Okay. Because that's something that we might want to check also.
I guess that could be a problem.
Of course not.
I hope not.
Alright. And Crystal, when they were doing your blood work, do you know if they checked you to see if you were immune to rubella?
I'm not sure.
They might not have told you. You ever had chickenpox?
Yes.
Okay.
Is Rubella a medicine?
No, so the reason I ask is we want you to get pregnant, okay?
Okay.
So we can draw blood, we're kind of unique here in that we get you before you're pregnant. So we can screen you to see if you're immune to different things, if you carry different genetic traits before you get pregnant, so that going into pregnancy, you're better prepared.
Oh.
Rubella
okay.
is, it's a German measles, okay?
Mhm.
And we all get the MMR vaccine when we're younger.
Mhm.
For whatever reason, some people as they get older, their immunity or their ability to fight off that infection goes down, okay?
Okay.
So when you're an adult, you might not be immune to that disease anymore.
Oh.
As an adult, it's no big deal. If you get infected with German measles, you get kind of sick and you're
Mhm.
fine. But if you're pregnant and that happens, you can transmit it to the baby and cause a severe infection to the baby.
Oh,
Okay?
okay.
The good thing is, we can test your blood to see if you're immune to this rubella. If you're
Mhm.
not, we give you a shot, just repeat your vaccination, and
Mhm.
then you can get pregnant a month after that. Okay?
Oh, okay.
If you are, then that's great. But that's the kind of thing where it's so easy to prevent that from happening, so we
Mhm.
check you to make sure you're immune, okay?
Okay.
The other thing, shoot, let me go grab a pamphlet really quick. I'll be
Okay.
right back, okay? We usually don't, we're seeing so many patients today, we usually don't see anybody in this room.
Oh,
so
okay.
I'll be back in 1 second.
Okay.
I'm recording her. So you can look back at it.
Oh, okay. I heard of it before, yeah. I think that's one of these new things out.
So Rubella is what they shoot you in your arm with. So a semen analysis is sperm, isn't it?
Right, I could,
had
they
it done a
test your,
long
you
time
test your
ago.
sperm and stuff.
Mine's probably dead.
No. Well, it says no such thing as that.
Okay, got it.
Oh, yeah.
So, kind of on the same sort of wavelength, we do offer testing here for cystic fibrosis. What that is it's a genetic disease, it's a lung disease that is transmitted to your baby, okay? It's fairly common so you need 2 copies of the gene to actually have the disease. It's a recessive trait, kind of like sickle cell.
Oh,
Either a
okay.
sickle cell trait or sickle cell disease. To get the full disease, you need 2 copies of the gene. If you have the trait, you just have 1 copy of the gene.
Oh.
Some people with sickle cell trait are actually affected a little bit. It's kind of different, so cystic fibrosis, if you only have 1 copy of the gene, you don't even know you have it.
Mhm.
Okay.
The reason we bring this up is, in Caucasians, it's actually fairly common, just like it's common to have sickle cell trait as an African American, it's pretty common to have cystic fibrosis trait as a Caucasian. About 1 in 26 people carry a copy of the gene. It's not very common to have sickle cell as a Caucasian, just like it's not too common to have cystic fibrosis as an African American. So we all get hit by different things.
Right.
It has the frequency here, but I think it's somewhere around 1 in 100 African Americans carry 1 copy of the gene.
Oh.
So it's not very common. We do offer this screening to everybody. I more aggressively push it towards Caucasians because it's so much
Right.
more common. For you, it's optional, but not all insurances cover it, and it can cost up to $200. So it's the kind of thing where you guys can discuss it, like how, if you don't have somebody in your family that has cystic fibrosis, you know, the utility of this is low. Could you still have it? Sure. Could he also have it? Sure. But the chance of both of you having the trait, being able to pass that on to your baby, is pretty low.
Oh.
So just something for you to think about. We offer it to everybody. It is optional.
Oh, okay.
So there's that. So kind of what did Dr. Parks talk to you about, and like, what do you expect from your visit here today? I'm
Well,
listening to
We
you.
want a baby. No, I'm just, I know it doesn't happen like
That's the
that.
easy answer, right?
she said it really wasn't her expertise,
Yeah.
so she recommended me to Dr. Emily.
Sure.
But she said by the fact I have the PCOS syndrome, that's what makes it
Yeah.
hard. But she didn't know was
what
the whole
to do
story.
or
Right,
anything
what to
like
do.
that? Okay.